Why is morale important?
We do a better job when we have
Positive
positive morale.
morale can increase our sense of agency, our effectiveness, our sense of involvement in an organization or a family or some kind of a group. How do you think the morale is as a human species right now? I'm thinking globally. When you think about the global human situation, how, on a scale of 1 to 10, where might you place the human sense of morale? A 2, pretty low, says Deborah. Anybody give a higher number? We are struggling, aren't we, as a human species? Why? Because in a large degree, we are at odds with each other. There's considerable suspicion, conflict, crisis. Well, morale is a noun that, according to the dictionary definition, is the confidence, enthusiasm, and discipline of a person or a group at a particular time. Confidence, enthusiasm, interesting to hear the word discipline. That sense of an alignment and connection that a group of people have with one another and to their sense of mission. You might say their morale was high, or in Deborah's case this morning, the morale of the human species is relatively low at the moment. What does it take to have high morale? Let's think about our organization, our connection together as a community. What's important for a high sense of morale? What would you say?
Investment in the mission or the purpose.
Investment in the mission or the purpose, a sense of meaning in what we do, no matter where we are in the organization, that we feel that we matter. What else would you say is important for morale?
Culture.
Culture. Chris, what do you mean by that?
A sense that people, our employees, are respected and heard, and that we create a positive place to come every day to do our work.
Right, okay. The culture that every employee feels respected, valued, included, and that the hours that you spend at work, which are 1/3 of your life, essentially, that matters, right? Was it last month, Brandy hosted our DEIB gathering, Diversity, Equity, Inclusion, and Belonging gathering. And in that gathering, most of us were, well, all of us were online hosting this, and so we weren't face-to-face with each other, but we could still see faces and ask questions. We explored, what does it mean to think about our sense of diversity, equity, and inclusion from a belonging standpoint? And she asked questions about what matters to you as a human being. And in your story, when have you felt that you belonged? The yard care people. And some of the people talked about, it's important for me to feel that I belong when I am safe and secure, where I'm valued, where what I do matters. Belonging is at the core of what it means to have a higher sense of morale. Now, there are extrinsic and intrinsic motivators for people in an organization like ours. Extrinsic motivators are things like what? Wages, right? You can be highly paid and work in a miserable organization and have low morale. But you can have lower wages and work in a place where you feel deeply valued and have higher morale. Now, I'm not advocating for low wages. In fact, we ought to keep pushing that, right? As we grow and as we increase, we ought to be able to push those wages so that that extrinsic motivator is also present for us. But let's not ignore how vitally important it is for each one of us to be in this organization in a way that we know that we belong, that we can make a difference, that we are safe and secure with who we are as we are. There's a lot of thinking today in organizational leadership about the value of persons being able to be real and vulnerable, even at work. And work is often one of those places we put up our walls, we wear our masks, and we hide. But when we do so, morale plummets. So we're wanting to shape a community where we can each bring our authentic self to the table when we're high and when we're low. And that we can exist in that organization without judgment. A few things that I found. Yosefa Iloli, I practiced this, I really did. Iloilo, Yosefa Iloilo, former president of Fiji, says, we need to reach that happy stage, and I think he's speaking as a human race, of our development when differences and diversity are not seen as sources of division and distrust, but of strength and inspiration. That's true for us globally as a human species. It's true for us in this smaller, experimental organization where we get to try to foster an environment where every single one of us sees everything that we can bring to the table, even in our great diversity, and our diversity needs to be greater still. Strength and inspiration. Sundar Pichai, CEO of Google, says a diverse mix of voices leads to better discussions, decisions, and outcomes for everyone. We need more people at the table, more diverse people at the table, coming up with better solutions to the problems that we face, and that everyone has a place at the table to speak their truth in their way. Audre Lorde, who's an artist, activist, and writer, says, it is not our differences that divide us, it is our inability to recognize, accept, and celebrate those differences. How can we recognize the differences amongst us? And rather, as our culture, our society, our global condition is leading us down a path of more suspicion and more division, how can we change that here for the betterment of our lives as workers and colleagues, as well as our patients and our families? And finally, Brené Brown, the sociologist, says that true belonging only happens when we present our authentic, imperfect selves, even at work. Our sense of belonging can never be greater than our level of self-acceptance. Now, I appreciate what she says, but I think there is a bit of a blind spot, if I can say that about Brené Brown. That this level of self-acceptance requires that people around us also accept us. It is hard for us to accept ourselves fully if the people around us don't. That's why we are existing in human community. So your sense of self-acceptance requires that I also accept you. My sense of self-acceptance requires that you accept me, that you're curious, that I'm curious, that we value this connection that we have together, and that we can build an organization where all of the differences are seen as a source of strength and inspiration. And when we do that, we can then truly be a place where each one of us feels we belong. And when we belong, we really can celebrate the power of an organization like this. So Tyler, let's begin with you. Come on up and give us an update on human resources. Human resources right at the hub of what I'm talking about, this sense of belonging, and how do we belong to the organization? How do we come in? I'm delighted that we have someone like Tyler, whose smiling face greets new employees, and he walks them through the labyrinth and the gauntlet of all those details. And that also shapes a culture. So Tyler?
Thank you, Chris.
Oh, gosh. There you are. It's the third button to advance it. Yeah, that one. Yeah.
Okay, so to get started, we're going to introduce a lot of new hires from this first quarter. So starting off with Rita, new RN case manager, Veronica, home health aide, Senior Rena, licensed vocational nurse, Tamila, registered nurse. We have Carly, Community Champion, Jasmine, Administrative Assistant, Alexia, Patient Access Technician, Alma, Home Health Aide. We have Jane, RN Case Manager, Monisha, Licensed Vocational Nurse, Hillary, Patient Access Technician. We have Josh, Registered Nurse, Jennifer, Licensed Clinical Social Worker, Wanisha, Licensed Vocational Nurse. Welcome, guys. We have our anniversaries, 1 year anniversaries in the first quarter of this year. We have Maya, Patient Access and Medical Records Technician. Kelsey, Registered Nurse. Ivy, Licensed Vocational Nurse. We have Shannon, RN Case Manager. And Renee, Brief Specialist. We also have 10 years anniversaries with
Woohoo!
And Danielle. Okay, and then just some information for our clinical staff. We still have our Enterprise Lease Car Program available. It is a take-home card that's available for both personal and work use. A couple of the perks that come with this is that you do get a gas card for any time you fill up. Insurance, maintenance, tires, registration, all that is going to be included in the monthly fee. We do have 2 options. So we have a small sedan, the Nissan Versa. It's $450 per month, broken down into 2 separate deductions with your paycheck. And then we also have the mid-size Nissan Sentra, $550 per month, and also broken down per paycheck. And if you wanted some information on how to sign up or just wanted some questions answered, feel free to stop by my office and contact me through Teams or email as well. Thank you, guys.
What was that? It's his stomach. Good job.
Good morning, everyone. I will be introducing our new volunteers for the quarter. Excuse my voice, I think my allergies are really getting to me, but. All right, we have Scott, Aldo, Aurora, Bev, Denise, Jasmine, Michelle, Sam, Shania, Juan, Sharon, and Yan, Renee, Lucky, Libby, and Gail, and Makash.
Wow. Woo! Okay, thank you. Wow, that's quite a crew. Serious additions to our community. Thank you. So now we come to our keynote, which is Dr. Mark LeBeau. So we're privileged to have Mark with us. Let me tell you a little bit about him. He's the Chief Executive Officer at the California Rural Indian Health Board and a citizen of the Pitt River Nation. He worked at, I'm going to be abbreviating the California Rural Indian Health Board as CRIHB. He's worked at CRIHB since 1999 in numerous capacities, including as a public health programs manager, proposal writer, director of the annual traditional Indian health gathering, health education specialist, and the health policy analyst for nearly a decade. He earned a doctorate degree from UC Davis with a dissertation focus on the implications of government policies on the health and healthcare systems of indigenous peoples in California. He also holds a doctorate or a master's from UC Davis sorry, I was afraid I was cycling forward in my slides. He also holds a Master in Science degree from UC Davis with a thesis focus on culturally appropriate public health programming in tribal communities and a bachelor's degree from Humboldt State University. Dr. LeBeau has served on the Pitt River Election Committee, Pitt River Health Services Board of Directors, and in Congressman Frank Pallone's office in Washington, D.C., working on American, Indian, Alaska Native legislative initiatives to benefit Indian country. He has been a member of the State of California Mental Health Services Oversight and Accountability Commission, Community Services and Supports Committee. That's quite a mouthful, isn't it? And Tribal Cultural Site Bill Drafting Work Group, as well as the Federal Advisory Council on Historic Preservation. He's currently a member of the Federal Centers for Medicare and Medicaid Service, Tribal Technical Advisory Group, chair of the group's Data Committee, and an organizer of CRIHB's advocacy and legislative initiatives in Washington, D.C. and Sacramento, California. It's a privilege to have him. I don't think it's in your bio, but you're also married to one of our employees, Teresa LeBeau, and we're just, Dr. LeBeau, we're absolutely delighted to have you here and to share your wisdom and expertise with us. Thank you.
Thank you, sir. Appreciate it. So do mic check. I have this microphone attached to my shirt.
Well, that microphone is for the video camera.
For the video camera.
So that won't give us
okay.
So either you go with your own volume,
okay,
or you'll have to.
I'll talk through this microphone then.
Mark, do you want me to advance slides for you?
Sure, if you don't mind. Yeah, that way I can hold my cup of water and my microphone.
Yeah, and you just give me a nod.
Awesome. Thank you, sir. Okay, well, good morning, one and all. Quite the bio. All of that stuff that your leader shared with you, I think it's important to further level set. You know, where do we come from? Where do I come from? Who am I? Who are you? Yeah, I come from Northern California on my mother's side. We're part of the Pitt River tribe, and my father was Cheyenne River from South Dakota, but born and raised out here. And where do I come from? What am I about? My people were created in northeastern California at the time of creation. We didn't, cross the ocean to get here. 500 years ago, my people were created by Mount Shasta and Mount Lassen and Medicine Lake at the onset of creation of human beings. So, level set. That's more important to me than all that other stuff, that's on my bio. That's who I am. That's where I come from. That's what's most important to me, is that little homeland. That little homeland up there in northeastern California is probably the most important thing, item, more important than a dollar to me. Because at the beginning of creation, when my people were placed there by Hewisis. Hewisis is, in my language, that means creator. You may have a terminology for creator in your own language, where you come from, but for our people, for Teresa, my wife, and I, and the rest of our community, how we say creator is Hewisis. From that time of creation until today, we have had the responsibility of taking care of that area. Just like you do at your homes. Take care of your home, take care of your area. Maybe you take care of your car, you clean it out, maybe you don't. And similar back home. You know, we're responsible for taking care of the land and all the other beings there. That's been our primary responsibility before there was Bureau of Land Management up there. Before the concept of Forest Service departmental services came along. We clearly predate the taking care of that land. The vast majority of our ancestors are buried up there. Do you go to the graves of your family members that have passed on and clean up the graves? Maybe you go visit once a year, twice a year, once a month. Maybe you're unable to go there because you moved out here from far away, but you go there and you take care of the graves of your relatives in a spiritual way, through prayer, through thought. Thought is so powerful. So level setting, who in the heck am I? That's really what's most important, is coming out of that area and doing my best to help take care of that region. Wanted to go over some slides with you. And so if we can go to that first slide, I'd appreciate it. So, had to give you some formal slides. So there you go. There's a formal slide. CRIHB. Can you go back if you don't mind? Yeah. So CRIHB and transitioning from one life cycle to another. YoloCares AllStaff meeting. So there's a lot of folks here. Don't know if anybody's playing hooky today, but just kidding. That joke didn't go over too well there. I'm a little tired. I've been up since 5 doing some advocacy work for the clinics, but there's a good joke I couldn't wait to share with you at that moment. Sorry, I kind of bombed it. Next slide, please. So I work for a little company called California Rural Indian Health Board, or CRIHB for short. And that organization was established in 1969. Kind of telling on myself, that's the year I transitioned into this world from the other side. That's the year that I came into this world, leaving the ancestors, and dancing and singing with them in an ongoing way. My time to come here was that year. The organization, you see the mission. CRIHB is a network of tribal health programs. That's a technical term. Tribal health clinics. And their tribal governments, or tribes, or tribal nations. CRIHB is committed to the needs and interests that elevate and promote the health status and social conditions of the Indian people of California. CRIHB does this by providing advocacy, shared resources, training, technical assistance that enhances the delivery of quality, comprehensive, health-related services. So, as it relates to Native American communities, Native American families, that means kind of everything and anything, right? Health and well-being. It means the taking care of a land area. It means taking care of the grave of an ancestor, protecting that grave and those ancient village sites. That means eating healthy. That means drinking lots of water. Hopefully you've all level set on hydrating with water this morning. If not, I encourage you to do so. Health and well-being, movement, body in motion is really helpful. Health and well-being, providing parenting courses to Native families to help remind them on how to parent children. You know, there was a time in this country when the federal and state governments removed Native children from Native households. Not for any kinds of related health conditions in the home or violence or due to any kind of violation in the home, but because that was simply the policy of the feds and the state, supported by the counties. Gotta say it, sorry about that. But some of my dissertation research, I took a look at the impact of policies on Native communities and the role of those tribal health facilities to revitalize, assist the tribes with restoring healthcare services and well-being. But there was a time here in this state when Native children were physically removed from their homes. They were taken to Indian boarding schools. There was a time in this area when Native families were forced marched to a little place called Round Valley. Anybody heard of Round Valley? Yep, I'm seeing some heads shake, yes. Covelo is another name for it. It's really important for the federal and state government supported by counties to remove Native leaders and their support systems so that the land could be taken, the resources could be taken. So it was really an important effort to stamp out Native identity. And one way to do that is to remove the children from the homes, send them to a Western-oriented school, have them live there 9 months out of the year, and then maybe return them home in summers. The best lawyers in the country, the lawmakers, you know, really couldn't change that kind of approach. It was an approach that was put forward across the land. So health and wellness and healing, you know, mending communities, mending families, even having the Indian children who graduated from those boarding schools, even helping them to heal from what they endured at night at 2 a.m. over and over in those dorm rooms when all there was you know, certain staff that would oversee those facilities. A lot transpired, you know, when darkness fell in those Indian boarding schools supported by federal and federal resources. So healing and wellness, I mean, it touches every aspect of Native communities. We talked just a moment about boarding schools. Mentioned just briefly protecting ancestral graves in Northern California. Just touched on it. Any number of topics relate to wellness and well-being. And so, so the work that we do at CRIHB, it's quite comprehensive. We have diabetes programs where we provide funding out to rural tribal clinics and tribal communities. We have trainers that work with the staff out there on helping to prevent, respond, and treat diabetes. Domestic violence. We have domestic violence services where we provide similar support out to the tribal clinics and the communities. We have a chief medical officer who works in concert with the tribal clinic providers, providing those providers the information they need. Maybe there's some latest research from, you know, a medical journal that would be helpful to the patients within those tribal facilities. Similar to you all, you have a series of registered nurses. We have some of those too that provide direct support to the nurses out in the rural tribal facilities. We provide management training for clinics that might need that, tribal governments also. How to write a proposal for those that we provide to those organizations. Helping to build capacity of the rural tribal clinic facilities and tribal governments focused on health and well-being. There's a growing body of research that documents and demonstrates that the strategies, the methods, the approaches that are indigenous to Native communities, oh my goodness, they can actually help stimulate health and well-being and healing from a loss. Of course, that's pretty straightforward. So building that in further into services, working in concert with Native communities, really important. It's pretty awesome to be able to say, to Native communities that often they have the answers. They have the methods. They know how to get it done. They just need a bit of support. They just need to learn how to write a proposal or balance that budget to include in the document. But that's one of the things that I really admire about working at CRIHB is, we really first take a position of the communities know what's needed. They likely have the answers. At CRIHB, we just need to provide a way for them to achieve their goals. Some of how we also do this is through advocacy. Advocacy, legislative priority setting, meeting with lawmakers downtown here in Sacramento, back in Washington, D.C., advocating, pushing, lobbying for more resources to provide out to those clinics and communities is really important. That way there's fuel, to move those vehicles forward in the delivery of health-related services. Next slide, please. So regarding advocacy, legislative priorities, the next couple of slides show just some of the work we're doing, like in the moment. In March middle of last year, we went to Capitol Hill in Washington, D.C., and we do this annually. We met with about 30 lawmakers, primarily from California. There was about 25 of us from various tribal health facilities and tribal governments. And so we converged on Washington, D.C. Of course, at CRIHB, we set up the meetings with those congressional offices, interfaced with the staff, organized the meetings, and it was separated into 4 different groups on the Hill. So, we had about eight people per group. And these are just a few of the legislative priorities that we put forward that week. A topic called purchased and referred care. My wife, Teresa, spent almost a decade working for the Pit River Health Service Clinic, coordinating, operating, directing their purchased and referred care program. Critically important program to tribal clinics and tribal communities in California. The Federal Indian Health Service provides funding across the United States to every tribe for health care support. The amount of funding that's provided is about 40% of what's actually needed. But nevertheless, it is some reoccurring funding on an annual basis that can be relied upon if Congress signs the appropriation bill, if there's not a recession, if there's not a rescission that pulls back some of those appropriated funds. Purchased and referred care is one of those line items within the Federal Indian Health Service budget. The funds are used to send Indian patients to the hospital. They pay for the cost of hospital care. Cost of a hospital stay in one of the local hospitals for 3 days might run $3,000, $5,000. If you stay there a little longer, 10 grand, 2 weeks, depending on the health condition and all the various support that's provided, can be quite expensive. So the clinics do the best that they can with the existing purchased and referred care dollars, but it's not enough. And because the federal government implemented policies that devastated Native communities, the authorized cleansing of the land here. And I'd like you for a moment to think about what we often hear about what's transpired with other communities around the world. The folks that have endured holocausts, slavery, being cleansed, their people being wiped out. That's what we experienced here. We don't let the federal government forget that, and in fact, it's only the tribes across the country that have been included in the U.S. Constitution, and I'm not talking about the two parties and fake or real news or anything like that, but it's only tribes that are included in the U.S. Constitution. The federal government reserved the ability to engage with tribes solely in matters of commerce and other activities. So if you go to the Constitution and you Google, you do a find check on tribes, you're going to find that, that section. It doesn't exist for any other populations or communities in the U.S. It's specifically engaging with tribes because of what was happening back then, right? The cleansing of the area, the removal of Native leaders to concentration camps like what we call today reservations. In the old days, in the 1800s, those were concentration camps. Those were prison housing communities and units. And a lot transpired in those communities in the dead of night when there were no monitors also. So the government now, the federal government, has worked to a point with tribes to engage in regular government-to-government consultation. And that's really important because it enables the tribes and federal agencies to come together and do cooperative, collaborative planning work. So when we say through those processes, hey, we need an increase in purchased and referred care, here's the data to prove it. Here's the cost of providing care in California as opposed to, say, Oklahoma. Big difference in cost of care and inflation here. And there's other factors that contribute to the overall cost of care in California compared to, say, the Oklahoma and in that region of the U.S. So we consistently advocate for more purchased and referred care funding. We strive for equity within the distribution of resources through the Federal Indian Health Service. What do I mean by that? Well, out of 12 Indian Health Service regions across the country, and California is one, 8 of those areas enjoy hospitals built, paid for, and staffed by the Federal Indian Health Service. So 8 of those regions, Alaska, Oklahoma, Great Plains, Navajo, IHS area, there's 8 of those areas across the country that have been provided direct access to hospital care, really for Indians as a priority. we don't have that out here. We've been denied that out here. And so the need for more purchased referred care funding so we can at least send our patients to stay in those non-IHS hospitals is critically important. So it's the kind of arguments that we make, we put forward on Capitol Hill and within the federal administration. And there is government-to-government consultation noted there. In this case, we've requested consultation with Secretary Becerra. He's one of us. He's from here. For 2 years, we've been working to meet with Secretary. Heard that it was going to happen in 2 years ago at the end of in winter, and then several times last year. It's never transpired. Under HHS rules, if a federally recognized tribal government requests formal consultation, that agency is obligated to meet and dialogue on the topic. Well, it's been over 2 years. So we've ramped it up. We took this to Capitol Hill. Congressman Huffman from his district is from North San Francisco all the way to the Oregon border. He knows Secretary Becerra quite well, so he's making a call to see if Secretary will come out to California and meet with all the tribes on the topic of inequity in Indian Health Service funding to tribes in California. Tribal leaders that I work with, they often remind me that the term equity, that's a fancy term that you're using, Mark. For us, it really feels like, you know, being left out or being discriminated against. A federally recognized tribe in California has the same status, ability, and authority as a tribe anywhere else in the country. So why is it that we're not afforded that access to that hospital built by Indian Health Service? So anyway, we're looking forward to next steps in dialoguing with Secretary Becerra. And feel free to give me a timer too, because otherwise I'll just keep rambling. But I know I have about 45 minutes at the beginning, and probably now I'm at about maybe 30 or so. But yeah, if somebody could just maybe in the back, just maybe give me a 5 minutes or 10-minute sign would be helpful. March 6th, House Approps Committee of Interior approved its Approps bill. It includes funding for the Indian Health Service. At that point, the Senate was still working on the related bill. Currently, we have a request going with the California lawmakers to include some additional funding in PRC support for tribes in California. There's 109 federally recognized tribes in California. Collectively, they receive a total of about $53 million for PRC support. Sounds like a lot of money, but again, you know, cost of staying in a hospital for 2 weeks, you know, with additional cancer treatment and other support, you know, you blow through $53 quite quickly, right? So our ask this year is to be treated in the same way as one of our other areas. So there's an area to the north of us that receives about 98 million. So that's our ask for the year. Just make us as poor. We want to be just as poor as that other area to the north of us. Congress, federal government, would you please do that? Whatever we need to do to make that happen. Make us as poor as that other area. Like, that just, I don't know if I'm blowing any minds other than my own on that. But that's really the situation that we're in. So the need for this kind of little organization like CRIHB, pretty important. The need for more organizations like CRIHB, extremely important. Currently, we have a couple of bills going in the state capitol. One is AB 1965. Really thankful that Assemblymember Rubio agreed to introduce that legislation. I did have the opportunity to testify before one of the subcommittees a month ago and sat side by side by Leader LeBeau. You read the language there, it's calling for the California Department of Public Health to establish an Office of Tribal Affairs and appoint a worker. Another piece to that is establish consultation, government-to-government consultation. We talked about that on the last slide, the importance of it, and the legal strings and where it derives from. And where does it come from? Where's the, what's the federal body of law that documents the relationship between tribes and the federal government? Dun, 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 dang, you got it. Constitution. So years ago, Governor Brown issued an executive order calling for all agencies within state government to establish formal consultation policies with tribes. And then our Governor Newsom reaffirmed that executive order. So Caltrans issued their consultation processes. Department of Social Service followed through, Department of Healthcare Service, Cal OES, the list goes on, with the exception of some agencies, such as the California Department of Public Health. Well, what the heck's going on? Earlier, we talked about the importance of tribal governments meeting with federal agencies and state governments. Collaborating, cooperating, planning work. The missions are the same. Improve health and well-being of Californians. So although we've asked the Department of Public Health numerous times to, I guess, comply with the executive orders, they're busy, they got a lot going. I get it. But we've reached a point where we have to apply some additional pressure and strategy. So yeah, we got a bill going. We're excited about it. The department is doing some good engagement with tribes and tribal clinics. I don't want to say that they're not, because they are. One of the things that we learned, though, going through the pandemic is we could not access our own Indian data from DPH. How many of our folks across California were in hospitals with COVID? We didn't know, y'all. CDPH has responsibility to interface with tribes. There is a federal regulation that documents that tribes have a right to their data. They are their own tribal public health entities. Yet all of those legal strings that we presented, didn't work. So we learned from that. And if we didn't move forward with another way to access that data, then shame on Mark. Shame on Mark, because if we're faced with a pandemic again, and we haven't prepared and planned and engaged and worked to ensure that tribal communities have access to their data, then I expect to be written up by my bosses. And I would probably do the write-up myself and have them sign it. Accountability, like how serious are you in your work? What does it mean to you? It means everything to me, right? Health and wellness down to Northeastern California, Next slide, please. There was another slide here, maybe in my rush. Can we go one slide down? There. Okay, a couple more legislative priorities. We also have a bill going, AB 2795, authored by Assemblymember Arambula. CalWorks Indian Clinic program, that's a program that provides small money, like it's a little over $3 million now. but the Department of Social Service provides that funding out to 36 Indian clinics in California, both rural and urban Indian clinics. And the clinics use the dollars to provide behavioral health services. So in healing, assisting patients and clients to heal from alcohol and other drug addictions, healing from domestic violence in the home, healing from violence from all other sources, healing from grief, from loss of a loved one, healing from loss of access to your ancestral homeland, being denied, and there's fences that bar you from accessing some of your most sacred places in Northern California, and you no longer can go there and fulfill the rights and the duties and responsibilities that you're required to, helping Indian folks to heal from that. So anyway, the Department of Social Service has quite a bit of reporting requirements, and I get it, you know, we all have reporting requirements. But I also get, and I'm aware and I know that quite a few of the funded programs and their funding agencies don't require a lot of overextensive reporting. I also know that some of the funding agencies provide funding up front to organizations so that they can do planning work, prepare as managers, prepare as staff for the first quarter or the first half year to do work. This program, it doesn't provide funding up front, doesn't provide advanced payment. It's on a reimbursement basis. So then all 36 clinics must go out and engage and document that they're convening community sessions related to healing and well-being, document their mileage in a second form and submit a third form and turn all that in order just to get your first payment to prove to the agency that you're doing the work so that you can pay your vendors, pay yourselves as staff. So we're working to flip that so that those clinics receive funding up front through a contracting process. So you know that old saying, it takes an act of Congress, right, to do something. Why does it take an act of Congress, you know? Well, this is taking an act of state Congress, but it's working. Pleased to report that over the last 2 weeks, the Department of Social Services at the state level, they've agreed to provide some advanced funding to the clinics now, even though this hasn't become law yet. It's not enough, though. They're proposing 25%. Each clinic is entitled to receive $107,000 annually to deliver comprehensive behavioral health, mental health service, AOD, effective treatment, culturally competent support services. $107 to serve multiple tribal communities affiliated with that clinic. It's not enough dollars. We're going to work on that later, but we got to get some of these other components in place, like making sure that there's some funding that the clinics can rely on at the beginning of the life cycle of that program. But anyway, yeah, so the state's agreed to provide 25%. We're pushing for 50%. In fact, today is the last day for clinics to submit their letters in support of the bill by 5 p.m. to the Assembly Human Services Committee. Was on the phone early this morning and last night, and we got about 7 letters plus CRIHB's letter. So that's probably enough, but we'll do the best that we can to get more letters in. So we're happy that the department is willing to work with us and the clinics in the way that they need. 10 more minutes in the way that the clinics need, right? And so that's the work of CRIHB. The communities know what they need. They know the support they need, and then CRIHB really should do our best to provide it. And then minimum wage law, I'll stop there on this slide, but minimum wage law was signed in October of last year. $25 per hour. Our clinic said, you know, we're getting 40% from Indian Health Service. If this is move forward, we're gonna have to close some departments to pay the 25 for some staff. CRIHB worked on an exemption. Tribal governments often are exempt from various state laws, so we got an exemption, but that doesn't solve the clinic's problem, right? If the local tribal clinic doesn't have to pay 25 bucks, but the non-Indian clinic 3 blocks away is paying $25, those staff are going to go over there. So we're doing workforce development, more advocacy work for staffing for those clinics. And then along with that came UICs. There's lots of acronyms in your work, right? Lots of acronyms in ours. Urban Indian clinics were also included. So although there's an exemption, the clinics still, they've got to find the dollars to provide and support their staff. So next slide. And then can you go back to that multicolored one? That multicolored, yeah. So this is our membership. A NAV clinic up to the west of Wairika, Matheson, Sonoma County Clinic, Toyabe down in Bishop, Tule River down by Porterville, United Indian Health Services on the northwest coast, Warner Clinic, far northeastern California, Chappaday, Feather River, Greenville, Karuk, Kamal, Lake County, Pitt River, Redding, Riverside, San Ynez, Southern Indian Health, and Table Mountain. And then you see all of the tribes. So all of these tribes, they issue resolutions. They issue laws, just like federal and state governments do. So they've all issued resolutions authorizing those clinics to provide health care in partnership with federal Indian Health Service, including, you know, behavioral health, mental health care. So that's quickly how that process works. And I think that was the last slide in that stack. So I got 7 minutes left. So I wanted to talk with you also about you know, the work that you do and your focus, whether directly or indirectly, your focus is helping an individual, families, communities prepare for end of life or transitioning to the next world. And, you know, I'm really honored to work with you. I shared that with you at Sac State when we were there that morning. When you all called again, like, yeah, I'll definitely come back because I believe in you and I believe in the work that you do. And if there's something even small that I say or that I'm sort of a conduit from other folks, my mom, my aunties, my elders, communicate that out. And if some of that, you know, assists you in your work to be even more effective than you already are, like that's enough for me, you know, even if it's just one person. So transitioning, end of life cycle, quite diverse, and I've read through quite a bit of your material, and even other hospice programming in other parts of the country. There's a few sections that are devoted to Native American communities, and I know that that's a focus of priority for this organization, and I applaud you and I thank you because that helps the health and well-being of the families and the communities. That even helps the individual who's getting ready to pass on or cross to the other side. In Pitt River culture, there's a lot of components that goes into the preparation and support of the individual and the family and the band and the village when they're getting ready, an individual's getting ready to pass on. Just real quick, some key points to that or key examples is what the family wants in that time. Guess what? The family gets. What the family wants, the family gets. What that individual wants, the individual gets. I was thinking about that over the last several days. You know, to me, if I were asked to go and help to build the bridge between an elder who's getting ready to cross and his or her sibling, they haven't talked for 30 years, and if I'm asked to do that by that family as a part of this process, guess what I'm going to do? Guess what I have to do? Traditionally, my traditional rules, guess what I'm responsible for following through with? So if that sibling lives in Florida, then if a call won't convince the reunification of those two, then maybe Teresa might have to jump on the Greyhound bus and head to Florida, right? So, but that's one of the traditional rules is whatever the individual and the family wants, the family gets. And although, like, I've been raised, traditionally, I mean, if that individual and that family ascribes to other spiritual faiths, and they ask me to go find that kind of healer or pastor, guess what I'm going to do? I'm going to go and find that individual and try and get that person there. I imagine there's some folks in the room who have served as pallbearers. Is that about right? I'm hearing a few uh-huhs. Imagine there's some folks who might have served as putting together the flowers and been responsible for the carrying of flowers as a part of that transition time. We have that too in my community. If the family asks, you do. So from time to time, I'm asked to help dig the grave. And I don't say, oh, gosh, I'd love to, but no. You can't do that if you're truly committed, right? Now, something might happen to me and I can't physically make it there. But my job isn't over then. I got to fix it. I got to make payment. If I can't be there, then I have to give something of myself as a part of that process. But yeah, for me, like one of the things that I really appreciate and really appreciate helping to take care of an elder who's getting ready to pass, and what does that mean? I walked into a hospital room where an elder's there getting ready to pass, and a lot of other of my colleagues, my folks, my communities have walked through there, but they don't see that, she's laying there and she needs lotion on her hands, on her arms. So guess what I did? Whatever needs to be done, you do. Whatever needs to be done, you do. And you don't expect accolades for it. I give you that kind of example, just as an example. I went and spent time with a medicine man who was getting ready to pass about 3 years ago. And his nurse was helping him at home, in the patient bed there. And his toenails were kind of long like mine. So guess what I did? I clipped his toenails. Yeah, I'm a CEO of some corporation running $70 million in programming. At the end of the day, though, I'm a simple human being struggling, striving to do better and help the earth, help people where and when I can. So I encourage you in your work. As we talked about at Sac State that morning, this is just transition, right? Earlier, I started out by saying I arrived here in 1969 from the other side. I came as a spirit baby into this world, and I'll leave. I'll leave in spirit form, and I'll transition For you, it might be you walk through the pearly gates in the clouds, right? For me, I ride the back of an eagle to Mount Shasta. And then from there up to the Milky Way. That's where my ancestors are. So, and then also, the last time we met, we talked about how you can tune in. Anybody remember the concept? The tuning in, like a, you got it? You don't got it? Okay. Radio. Yeah, you can tune in to your ancestors if you focus. And it may not happen right away. It might take you a year. Is it worth it? It might take you 5 years. Who knows, right? Might be instantaneous for some. That's really awesome. But you can tune in if you focus and have some dialogue. And it might even come through a dream, or it might come on the wind, some words to you from your grandma or your auntie or your mom or your uncle or whomever. And similar to last time we met, when I say that, does that mean I'm loco? You know, that I need to be medicated to numb that ability or numb that kind of engagement? And for me, you know, the answer is no. I think I'm pretty sound. At least I hope. Teresa, you can talk to Teresa if I'm pretty sound. But yeah, there's even that kind of potential. Maybe next time I'll be invited and we can talk more deeply about these kinds of processes. So with that, I'll conclude. Love to dialogue if there's a moment, and even answer questions, or it'd be great if folks would
Let's see
share.
how... So there are some things that I've taken away, Dr. LeBeau, and I'm just curious, what has come up for you? What have you heard Dr. LeBeau say that has stuck with you, challenged you, troubled you, or inspired you this morning?
I'm pretty good at picking out volunteers too, so let's see. Just kidding. Yeah. There we go. Yes, you.
I would say that it was unexpected that California Department of Public Health would not have an office of immediate care or liaison for all of the health clinics, and I've seen a lot of them popping up in downtown California. That's surprising.
Yeah, it is surprising. They do a lot of good work with us, but in terms of that kind of consultation upstream of when they build their budgets, you know, we get surprised when the budget's put on table and it's already in writing. When it gets to that point, it's very difficult to change the calculations on those line items. But there's other departments too. We're all a work in progress, right? Even the departments. All right, and then there's another, yeah, yes, ma'am.
I guess the big takeaway for me is just the enormity of the challenges that you're looking at, and I look at our little agency, and I kept finding, like, looking for where can we support, how can we support, how can what we do, I know what we do has a place in healthcare, obviously, but in terms of the challenges that your communities face. You know, I work at the side of barriers. I'm trying to get money to help us take these barriers down. That's my position here. So I'm really looking at those barriers and which ones can we address and how can we help, so that then we can move forward with those plans and try to bring that funding in to come back to you and say, hey, can we help with this piece of it? That's where my brain is. It's just so much, there's just so much spinning that I can't even form a question. It's just more to share that that's what comes up for me.
Yeah, planning work, right? I mean, just scheduling meetings, do some deep planning work, brainstorming, hearing from communities on what they might need. You know, out of that planning work could come some identified goals and objectives. So yeah, I mean, maybe we can work on that down the road. Good. Others? Yes, ma'am.
I think the data, you know, not having access to the data, just, you know,
we would think that that was not possible, and that technically, technology is everywhere. Like it seems like that should be such an easy thing, but the historical piece of not having access to your own information, I think when I think about that, for many cultures, like it wasn't that long ago. Like we're still dealing with so much of that. The history really isn't that long. It's still happening. You know, we're still, there's communities that are still underfunded and unable to have their own information, or not given even the resources to build their own system to collect their own information. It's crazy, it's California. We're driving everything in regards to technology, but we can't do it still in certain areas.
Some of it, I mean, it's genuine misunderstanding, right? So HIPAA, you all work with HIPAA. Got to comply with HIPAA, all the trainings and the certs and everything. So for some staff within that department, they're abiding, from their view, they're abiding by it. So then it's up to tribes and tribal clinics and CRIHB to help show them that it is legal to share data in this kind of way. So that's what we're working on, you know, with CDPH now. So, but we'll get there. You know, I'm confident. Additional input, thoughts, concerns? Yes?
I was wondering if you could pronounce your name for Mount Shasta.
Pronounce what?
Your name for Mount Shasta.
Oh, yeah. Hey, Teresa, I didn't even know she was going to put that up there. Yetaku. Yeah, Yetaku is the name for Mount Shasta. They asked, leader, so Mount Shasta is really important. The very first place when the world was created for Pit River people, the very first place when the world was created was Yetaku. And then the second place was Satitla, the sacred Medicine Lake Highlands. And Hewisis came down to Yetaku and then went over to Satitla. And what is Satitla? Come on, team. It's Medicine Lake, sacred Medicine Lake Highlands, Satitla. So Yetaku, Hewisis went to Yetaku and then went to Satitla, Medicine Lake, and engaged with the water and washed in the water and left healing properties in the water at the beginning of creation. So guess what we often do when we need it? we go to Satitla, we go and wash. There's deeper work, protocols to it. But when I was a little boy, I'd be riding an old Indian car, and we grew up poor. We rented a home for $90 from two really, really wonderful Irish people. So I grew up in that home. It was we were poor in terms of money, but rich in terms of a safe environment and culture. So I wouldn't trade that. I wouldn't flip it. But I remember riding in the back seats of those cars, and Mom would pick up other aunties or uncles or elders, and they would talk about Medicine Lake. They talk about Satitla up there in the mountains, and they would say that that place is so important or so holy that you can't go there and not, you have to be in the right mind. You have to think appropriately, respectfully. You can't think about stealing $1, molesting somebody, robbing somebody. Think about oogling, other people. You got to be there in the right way with focus. It's nothing to play with. That's how important that area is. So But yeah, so thanks for asking. Yeah, Yeraku and Medicine Lake. Any final questions or comments? Yes, ma'am.
I'm just curious how you got to where you are today. What path did you take? Was that a long way?
I'll try and make it short. So have you ever watched that film with Adam Sandler? And in the film, like, he often talks about his mama. Waterboy. Well, in the film, he often says, Mama says. Mama says, so I do this. Mama says. So yeah, this is my mom. And then, you know, her colleagues and elders and extended elders. But yeah, Mama said I have to go to college. Yeah. So it's part of my responsibility and duty, right? So took it very seriously. So, but it's interesting too, because in the same household with the same content and traditions and rules, it's like a box of chocolates. So my sister's a little different than me, you know. So it's just kind of interesting too, you know. As long as we're healthy and well, it's key. So, all right. Well,
Dr. LeBeau, you have honored us with your story and your testimony. And, you know, we've had this tour of a very painful history, right? And the ways in which communities, like the ones that Mark leads and he's connected with, are trying to change the structures of oppression. I'd like you to think a little bit about, where do your people come from? Where are your indigenous roots? What has happened in Western medicine is we have been dominated by particular cultural assumptions, largely dominated by people who look like me. But I have indigenous roots as well. 2 years ago, my oldest son, who was turning 30 at the time, wanted to be back in the small village in northern Germany, where our people came from years and years ago. He wanted to be in that small village that hasn't changed much in hundreds of years. My own people have indigenous practices that are much more similar to those of the indigenous people here than we might imagine. What we're working at here at YoloCares is trying to find ways of honoring one another's heritage. Those roots, that DNA that's deep inside each one of us. And when we go into a work situation, a home, a hospital, when we talk to somebody on the phone, when we're paying a bill, we have to remember that each person that we're encountering has a particular story. Unfortunately, we have, and I use the word intentionally, whitewashed the ways in which we do healthcare. We've got to change that. We've got to take a deeper dive into the history of all of us as a people and find ways in which we can be enriched because of that diverse background. A few sessions ago, I spoke about cultural humility and the ways in which each one of us needs to be able to take off our glasses, the glasses through which we see the world, and work to put on other glasses to see the world through the ways other people see it, and then we're going to be enriched. So as you go about your work this week, I hope that what Dr. LeBeau has done for us today, telling this larger story of oppression, injustice, and incredible courage to transform the way we do healthcare in California, in America, in the world, that you can do a little bit in your own way to honor the particular people you're working with, to honor your own history, to honor the diversity. Did you see the immense diversity of our new employees and our new volunteers? To appreciate what each one brings to the table that can enrich us deeply and challenge the suspicion, the separation, the judgmentalism, and the cynicism of the world in which we're living. And we can change that as a little organization here doing this kind of healthcare. So I want to end with inviting any questions you might have for our senior leadership. If you're one of our senior leaders, one of our directors, please raise your hand so people can see you. And are there any questions for our senior leadership today as we close our meeting? You can put your hands down.
I'm
Good question. This came up in our staff meeting yesterday as a department. I'm the director of the Center for Loss and Hope. And we've heard that we serve the 5 counties. And what are they, folks? Yolo, Sacramento, Sutter, Colusa, and Solano. But we've heard that there are 5 other counties that we're now authorized to serve. Who knows what they are? Placer, Yuba, Napa. Nobody's talked about it. So, Deborah, that's in development. Okay. Okay. Right.